Thank you very much. Hi, everyone. Let's get going with statistics. Again, numbers keep going up in Ontario. We're up to 4,736 case increase from yesterday to today. It's really creeping up there. And we've got an increase of 29 deaths across the province. And again, this is led by Toronto GTA area. We had 342 cases in Ottawa. And again, our numbers are continuing to increase, in going into the wrong direction. So we now have almost 500 cases, and we're up to 390 cases. And I'm going to talk about an anomaly that occurred yesterday. I know I had a lot of questions in the briefing here. Just to explain that we had done a cleansing, a cleaning of the data, and it inadvertently added many cases elsewhere, subtracted cases elsewhere. So the initial, and it automatically uploads our website. So when I noticed that, we took it off yesterday, and we added the correct number. Yesterday's increase was 57 from the previous day, and now today's increase is 61. Again, we're going to clean up the data again tonight, and just to make sure that because I know it doesn't add up from the numbers, but we're gonna clean. We're running through the program again tonight, and we're gonna connected appropriately tomorrow. So that's why it was. I mean, it looked like there was 186 cases down. I know, and when you notice that, we took it off. It's an automatic process that once we run the numbers, it goes to the website. So that's why we removed it. And so, but again, whether it's a case or two, the bottom line is that we had an increase in the 50s yesterday, 57, and today 61, with again 32 in Prescott Russell, SDNG 10, and Cornwall 19. So again, this is just we're seeing the numbers, like I said, continue to sort of stay in the high range. Again, we're looking at Cornwall, we're looking at DNG, we're still in the 150 and 160 range, 140 overall in terms of our 7-day average. As you can see here, it's kind of, went up, and it's kind of stayed up there. Let's hope that we will get a bit of a decrease moving forward. I think it's important to note that we are having a lot of difficulties with our hospitals, as you know, across Ontario. Our hospitals as well. At this point, we have multiple admissions, including 8 ICU admissions, as per our website, and our hospitals are really sort of at capacity. And as you know, provincially, there's been all kinds of shifts of patients being transferred from GTA to other areas because as of the latest figure that I got today, in the province, we were up to 648, I think, ICU admissions, which is quite high. I'm talking about COVID admissions, and so in our area we have 8 in our area. So, and 6 of them are in Cornwall, 1 is in Hawkesbury, and 1 of them is in Ottawa. So again, the numbers are up. We're hoping that we'll see a bit of a decrease. I think that it's reflecting what happened on Easter weekend. So I'm hoping that they will go down. And if we look at other sort of indices, we have a total of, I know that schools are closed, but at this point we've got a total of 96 cases this past month, just in April, in 43 schools. Again, schools are closed this week, as you know, and they will not resume in person next week. But you can see that the numbers are creeping up. Just for context, in the month of February, we had 34 cases. In the month of March, we had something in the 90s, and right now we're already. This is just not even the middle of these numbers. Don't reflect even up to the middle of April. In terms of our long-term care facilities as well, again, we've got a couple of long-term care outbreaks or retirement outbreaks, but again, nothing's changed. And again, most of the other outbreaks do not include residents themselves. So I just wanted to now pivot a bit and talk a bit about vaccination. So again, to clarify, we will correct the numbers tomorrow, but the additions are there. It's just a matter of it was the data cleansing that occurred, and I know I've got most half the questions that I got on my pre sort of briefing notes from you questions were related to that. So I just want to now pivot a bit to. Vaccines and by the way, one of the things that I was noticing here is that if there's any good news, when I'm looking at the ministry numbers of progression of VOCs, last week we were at 73%, and now we're down to about 54% of VOCs. So, but we're still seeing VOCs, and some of our outbreaks are VOC driven. So again, that's not a reason for us to be complacent. It's just a reason for us to know that it's in our area. And, again, still most of our cases are VOCs. It's more than half. And we need to be prudent. And again, I can't stress enough that these next 2 weeks are very important. It's up to us. We don't want to overwhelm our ICUs. We don't want to overwhelm our hospitals. The system really requires that we do as much as we can, stay at home, and so on. I can't stress that enough. And I know I keep saying that, but that's really that's where we are, unfortunately, at this point in time. So let's go to vaccines right now. And just as today we're going to be sort of sharing some of our numbers. Between April 8th and April 14th, we vaccinated 9,000. We administered over 9,241 vaccines, and that doesn't count. We're missing a few from the hospitals, and in total. As of yesterday, we were at almost 38,000 vaccines delivered, and we're delivering 2,000 today. And so over the next while, so just to give you an example, between April 10th and May 7th, so this past weekend, Saturday and May 7th, we're going to be holding 34 mass immunization clinics that include 17 in Prescott Russell, 17 in SD&G, and our ability is really about 1,000 clinic. We can vaccinate more, but right now, because of numbers, we're vaccinating about 1,000 per clinic. So we're doing two. So it'll be, because we have 2 clinics a day over the next or over 4. Let's put it this way: 8 clinics a week. Let's put it this way. In any case, if 34 clinics vaccinating about 1,000 each, we're going to be vaccinating in total close to 34,000 people. Again, I know over the weekend we did on Saturday over 2,000, and on Tuesday as well we did. I think it was 2,134 in total in 2 clinics. So we can rev up these clinics, particularly the Cornwall and Benson Center. We can go up to 1,500, 2,000 a day. But again, it has to do with supply. Speaking of which, we did get a partial delivery of Moderna, which is good this morning. We got it this morning. We're going to be looking at our numbers. We do estimate that we will have enough moving forward with the vaccines. And so one of the things that we're also adding on is we have a mobile clinics. So again, in addition to these clinics that I'm talking to you about, over the next 4 weeks, through the week of May 7th, the end of that week, we're also going to be delivering vaccines through our mobile teams to congregate living quarters, for example, lodging homes, senior apartments, group homes, and so on across our area. That's actually starting already. So that's going to be extra vaccines given. We've also, as you know, have 6 pharmacies in our area. I'm not sure which one when the Cornwall one will start having ability to vaccinate, but I do know the other one. There's 2 in Cornwall. 1 in Fresco is actually, you can make an appointment there. And as I said the other day, we have six in total and expecting to get more. We're also delivering vaccine, particularly in the Cornwall and surrounding areas, to community health centers, looking at vaccinating highest risk chronic medical conditions as well in our area. And we're also going to be delivering it to other health teams across our area as well. In addition to that, our hospitals are now starting to vaccinate. Cornwall's vaccinating on a regular basis, and the other three hospitals, Hawkesbury now is vaccinating, as will be very shortly Alexandria and Winchester. And so, with all these numbers, with all these availabilities, we'll be increasing our. We have a capacity. It's just as I said, it's the numbers that are coming in, and what we've done now is we've kind of based our numbers of vaccine that we will have allocated to us between now and the first week of May, and we allocated it to our mass immunization clinics, of which more than 30,000 have been booked already on the period that I told you about. So we hopefully will get some allocation updates over the either today or over the weekend. So we'll be able to plan into the May months. But if you just do a kind of rough calculation right now, like I said, we vaccinated 39,000, because we haven't included some of the clinics there yet. 39,000, and moving forward, over the next, let's say we do another 30,000. So you're looking at, vaccinating close to 69,000 individual first doses, at least first dose in that population between now and the end of this month, the first week of May. So hopefully we can, if we get more, and we can rev up some of these clinics, and we could do 3 or 4 a day, we can really, I think, be confident in vaccinating the people who want it first dose by the end of May. Again, pending numbers, but we do have the capacity, the machinery is there. I want to thank all our community partners. I want to thank all our municipal partners, all the volunteers for helping. Today I went to the Embrun Clinic. We had one in Embrun. We're also going to be scheduling other clinics in other areas as well. We are having a clinic in Plantagenet as well with a family health team there. Rockland is having clinics as well with their family health team. So we're trying to, like I said, there's going to be multiple venues for getting the vaccine moving over. One of the things that just struck me yesterday is that in one of our clinics, obviously we have people gathering for vaccinations, and somebody called the police, said there was a gathering there. Just to let you know that public health and government emergency government operations, like we're doing right now, are exempt from this. Obviously, we're physical distancing. Everyone's wearing a mask, but again, that is just struck me as a bit bizarre yesterday. And that's it, really. We're anxious to get more vaccines, and like I said, get them to the arms of people, and hopefully, like I said, I'm hoping that over the weekend, I don't anticipate that we'll be getting a reprieve. Probably the numbers will stabilize and then go down. Hopefully next week, because that'll be like a full 2 weeks of kind of a lockdown type situation. So we'll stay tuned for that. And again, urging people to stay home as much as possible. Only go out for essential purposes, really. You can see now we're really and even with limited numbers and trickling numbers, we're going to have vaccinated a substantial part of our population by the time this lockdown ends, and hopefully we'll be able to look at sort of a summer that has less restrictions. But again, it all depends on numbers we're getting and the way that the numbers behave in terms of our case counts. Bonjour tout le monde. Je vais commencer avec les chiffres ontariennes. Encore, ce n'est pas des bonnes nouvelles. On a augmenté nos cas de 4736 cas depuis le jour précédent. Et toujours, c'est Toronto qui mène avec les cas. Ottawa avait 342 cas d'ajoutés. Nous avons ajouté pas mal des cas aussi. Et puis, il y avait un problème de notre ordinateur, de notre système de collection de données. En effet, nous avons hier, juste pour expliquer, hier, nous avons fait une ménage, si vous voulez, au niveau des données, et pour une raison qu'on ne comprend pas, ça a changé les chiffres, ça a diminué 189 cas de notre personne, puis ça a ajouté 189 cas dans une autre région. Ça, c'était une erreur, mais avec le système que nous avons en place, aussitôt qu'on a les chiffres, ça va directement sur nos sites web. Nous avons réalisé ça après, donc nous avons retiré. Donc, il y a encore un cas de plus ou moins. On va calculer ça ce soir et demain, on va le corriger. Par contre, c'est très important de savoir que les chiffres qu'on a augmentés sont là. Malheureusement, on a augmenté de 57 hier et aujourd'hui, on a augmenté de 61 cas. Donc, vous voyez 19 cas à Cornwall, 10 à SDNG et 32 à Prescott Russell. Donc, on a toujours un débit qui n'est pas bon, à mon avis. En effet, on voit toujours qu'on est vraiment dans zone gris, vraiment dans zone de lockdown. On voit que ça commence en plafonnement ici, mais on ne voit pas une nette diminution. Donc, j'espère qu'on va avoir ça d'ici quelques jours. Il faut dire que tout ça, vraiment, c'est secondaire au fait qu'on avait beaucoup de personnes pendant le fin de semaine de Pâques qui avaient des parties, qui étaient ensemble à la maison, plusieurs foyers ensemble, et nous voyons le résultat. Espérons que ça va, avec tous les différentes choses que nous avons fait au niveau de rester chez vous, de l'ordonnance, etc., la déclaration d'urgence. J'espère que d'ici quelques jours, on va voir un plafonnement et une diminution des cas. Autrement, on est débordé, nos hôpitaux sont débordés, non seulement dans notre région, on a une trentaine, 36 cas, je pense, hospitalisés, 8 sont dans des soins intensifs, 6 à Cornwall, 1 à Hawkesbury et l'autre à Ottawa. Donc, c'est une débit importante, c'est une surcharge très importante pour nos hôpitaux. Et comme vous savez, on a des admissions en record 645, je pense, dans les hôpitaux aux soins intensifs à travers l'Ontario. Et ceci, ça menace de paralyser nos systèmes, en effet. Donc, c'est pour ça que c'est très important qu'on fait attention, parce qu'avec les variantes, dont laquelle, la bonne nouvelle qu'on peut dire, c'est que nous, on est maintenant rendu à 54 de tous nos cas. C'était 73 la semaine passée, mais quand même, la majorité de nos cas sont des variantes qui sont plus faciles à se faire transmettre et donnent une maladie un peu plus sévère, et même pour les personnes moins âgées. Donc, c'est pas le temps, c'est vraiment très important. Je ne peux pas souligner plus que c'est très, très important qu'on reste chez nous, on respecte l'ordonnance de rester chez nous, parce que sinon, les hôpitaux vont être débordés, et aussi, on va avoir des personnes hospitalisées aux soins intensifs. Bien entendu qu'ils sont plus jeunes, mais il peut avoir, après l'admission aux soins intensifs avec intubation, etc., c'est sûr qu'on pourrait avoir des conséquences à long terme. Donc, c'est très important de rester chez nous le plus possible. Au niveau de nos autres cas, au niveau des flambées, il n'y a pas beaucoup qui a changé. Au niveau des écoles, bien sûr, on n'a pas, les écoles sont fermées à cause de congés cette semaine. Comme vous savez, la semaine prochaine, ils vont être fermés aussi. Ça va être à la maison, au niveau en ondes, en ligne. On a, dans le mois d'avril, on a total 96 cas dans 35 écoles. Je m'excuse, dans 43 écoles, 96 cas. Donc, juste pour vous donner un exemple, au mois de février, on avait une trentaine. Tout le mois de mars, on avait 96. Et là, on est rendu à 96 cas. La première, même ce n'est pas la moitié du mois d'avril. Donc, vous voyez, on avait une augmentation importante. Et donc, nous allons évaluer les écoles à chaque semaine pour nous rassurer, pour voir exactement les cas dans les écoles, mais aussi à travers dans la communauté, parce que c'est toujours les chiffres dans la communauté qui causent les écoles à avoir des chiffres, parce que ça vient de communauté et rentre aux écoles. Une fois que ça rentre aux écoles, on l'isole, mais ça cause beaucoup de problèmes opérationnels, etc. Donc, il faut continuer les mesures malgré qu'on fait un bon progrès, relativement bon progrès avec nos vaccins. Donc, dès aujourd'hui, nous avons vacciné nous avons donné plus que 38 000 doses dans notre région, et ça ne compte pas les doses aux hôpitaux actuellement. Et nous allons planifier entre le 10 avril et la première semaine du mois de mai, 34 cliniques dans notre région, donc 17 à SDNG, 17 à Prescott Russell. Et nous prévoyons avoir la capacité de vacciner à peu près 1000 par jour. Donc, on prévoit d'avoir à peu près euh, 32 à 34 000, dépendamment le débit qu'on va avoir, des vaccinations de données d'ici la première semaine de mai. Donc, si on rajoute, déjà, on est rendu à 38 000, 39 000. Si on rajoute un autre 30 000, on approche 70 000 de données d'ici en total, première dose, en total, dans notre région, aux adultes, aux personnes plus adultes, en effet, euh, je, euh, 70, 70 000 à peu près, c'est pas pire parce que nous, on cible de vacciner 170 000 en total, les personnes éligibles. Donc, si on dit 80% vont avoir le vaccin, à ce moment-là, on a presque la moitié là. Donc, ça c'est très bon. Et ceci, toutes les calculations que je vous donne ne comptent pas les vaccins qui vont être donnés par les pharmacies, on a ces pharmacies, et par les cliniques des médecins et des cliniques des centres communautaires qu'on va donner, on va donner à travers dans notre région, et aussi aux 4 hôpitaux. Déjà, Cornwall a commencé et Hawkesbury a commencé à vacciner aussi les personnes ciblées, les personnes éligibles. Donc, ça va bien. Je sais qu'il y avait une délai de Moderna. Nous avons reçu Moderna ce matin. Je ne pense pas qu'on a reçu toutes nos doses, mais on calcule et je pense qu'on est bien jusqu'aux premières semaines de mai. Déjà, nos cliniques on a 30 000 de bouquets. Il ne reste pas beaucoup de place d'ici la première semaine de mai. J'espère avoir plus de nouvelles ce fin de semaine au niveau des doses qu'on prévoit recevoir après la première semaine de mai. Et à ce moment-là, on pourrait en calculer. J'espère que ça va être une débit plus importante. Et à ce moment-là, on pourrait vacciner beaucoup plus de gens. Et je suis optimiste selon dépendamment des chiffres qu'on va recevoir, le montant qu'on va recevoir, qu'on pourrait offrir un vaccin à tout le monde dans notre région qui le veut d'ici le fin mai ou vraiment le première semaine de juin. Donc, je pense qu'on a sur le bon pas. Nous avons l'infrastructure, nous avons l'aide, nous avons beaucoup des partenaires communautaires et municipaux, des bénévoles, etc., qui nous aident parce que c'est des cliniques très compliquées à faire. Si on a 15 vaccinateurs, on a besoin d'un autre 20, 30 personnes pour aider avec inscription, dépistage, etc. La ligne, le contrôle de ligne. Jusqu'à date, ça semble aller bien, mais c'est un travail de collaboration très importante et je suis très reconnaissante à tous nos partenaires. Je veux juste dire que dans une clinique récemment, c'est sûr qu'il va y avoir beaucoup de gens qui vont approcher et quelqu'un a appelé les polices parce qu'il y avait un ressemblissement. Il faut dire que nous, dans les fonctions gouvernementales sont exemptes. Il y a une exemption au niveau de la loi avec les rassemblements. Donc, entre c'était un peu drôle que quelqu'un ait appelé la police pour ça. Donc, encore, je vais le dire encore, on procède bien. Le plus de vaccins qu'on va recevoir, le plus vite qu'on va vacciner les gens. Mais même à ça, on va être capable de sortir avec presque 45-50% de la population déjà vaccinée, première dose. Une fois qu'on sort les prochaines 2 semaines après, les 3 semaines, je veux dire, ça va être la première semaine de mai que espérons les chiffres vont être mieux et on pourrait en sortir du lockdown qu'on est actuellement. Mais entre-temps, il faut toujours maintenir les précautions de santé publique. So I'm going to answer some of the questions right now. Vaccine deliveries on schedule. Yes, actually, we're expecting an update, but we did receive some Moderna this morning, and which was very good. I'm not sure how many we did, so we're going to look at that. I've explained the numbers. Yes, there was a one fewer death yesterday, but it's going to be put back. It was just a matter. Initially, it was thought to be attributed to Ottawa, but it is attributed to us, so it's going to go back to us. The other questions are, we have question about the third dose of Pfizer vaccine. Again, we're not sure what's going to go with that one. If we need a booster, time will tell. I can tell you that from the point of view of Pfizer, yesterday Pfizer actually put in an FDA request for vaccines between 12 and 15 years of age. And so I do believe that we're likely going to be getting the same in Canada at some point. So we're going to have to pivot and look at vaccinating kids, likely in schools, because by the time everything's approved, it'll be by the time school starts. And that's it, Jenna. The other ones were really related to the numbers that I've explained.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul. SDNG Warden Frank Provost said yesterday during a press conference that he believed that a curfew would be better to help stop gatherings in the region rather than shutting down small businesses. Do you agree that a curfew would be a better idea instead of the small business shutdowns that's been happening?
Okay, well, you know, the shutdown is not a shut. Well, first of all, the curbside allowed. But notwithstanding that, I think we've always talked about curfews. We've always talked about that. I believe that stay-at-home orders are better because curfews will actually have people rush during the day and then rush home. So it'll actually overcrowd during the day. So I know there's a balance, and I agree with the warden that you know, our retails are taking a big hit. But I can tell you that on the other hand, if we continue up and down, up and down, up and down, without a, you know, sort of a blunt instrument of stay-at-home order, or even, I believe, like, I know that we've been talking, Ottawa's been talking about curfews in parks and stuff. I think that's something that we can consider. But overall, I know that I would prefer a stay-at-home order because it applies all the time, whereas curfews are sort of limited, and you have a time, well, people can rush out during the day. And again, we have to balance it between the closure of our retail. I mean, you know, sort of the the curbside is not the same as being able to go to the store. I understand, but they're not closed. They can still operate. However, we need to take some strict measures and keep people at home as much as we can for a week, for a month. Let's sort of bite that bullet and ensure that this will be the last time we do it. Because if we keep closing and opening and closing and opening, it's gonna be actually even more detrimental to businesses.
Okay, thank you. You said about more mobile clinics and that because you are getting more vaccine doses. Do you have any specifics with regards to South Dundas?
I will be calling my former board member, Steve Bivels. I will be calling him to discuss some locations there. Yes.
Okay, and lastly, have you been able to get push the goalposts any closer for pharmacies, both in South Dundas and in South Stormont? I mean, even for the EOH in general, like there's only 6 pharmacies.
I was told that as soon as they get increased supply, we're going to get many more. I was told that we're going to be getting as many as we have with flu, which is like in the 30-40 range. So it's a matter of, the only say I would have is when they have supply, I would say, okay, I prefer them to be there and there to make sure that we cover those areas. But I don't have a say in when they receive their supply because they're waiting for more supply.
Okay, thank you.
You're welcome.
Next question, James Morgan, The Review. Please go ahead.
James, you there?
Unfortunately, we can't hear you, James, but you're welcome to send your question to the chat box and I'll read it out for you. In the meantime, Nelson Zandbergen, Nation Valley News. Please go ahead.
Oh, hi, Doctor. I was wondering about the next step down in age for the Pfizer vaccine that you've been distributing. It went from 80 to 70, then 70 to 60, roughly a week each time. Are we looking at this Monday to have it drop to 50?
No, I don't think so. Don't forget, we've got to start looking at essential workers, at others in phase 2, chronic disease, and so on. So I don't think we're going to go to 50 this week.
Do you anticipate any circumstances where your clinics would be giving AstraZeneca rather than Pfizer?
Not at this point. The indications that we've been given is that we will be either giving Pfizer or Moderna, and AstraZeneca will be limited to pharmacies and or primary care physicians.
And finally, do you think the protests in Embrun and Russell could lead to some cases?
When were those protests?
They were on Saturday. They had some gatherings.
I don't know. I don't know. I didn't even know they occurred.
Okay.
Thank you.
Thanks, Doctor.
No problem.
Next question, Nick Seabrook, Seaway News. Please go ahead.
Hi, Dr. Paul.
Hi.
I'm sorry if you answered this. My internet cut out there for a minute. But I had a reader contact me who said that when they were at the vaccination clinic at the Benson Center, someone in front of them said they were a resident of Montreal
Mhm.
who owned property here in Ontario and Cornwall and were able to get an OHIP card and thus came here to get their vaccination. Is this something that you condone? Is this qualify as queue jumping? Is there some way you can prevent this?
Well, I can tell you that they're farther ahead of us in eligibility in Quebec than they are here. And I know that they have empty clinics in Quebec, so I don't understand why he would come here. I know I have relatives in Montreal. They've been vaccinated earlier than a lot of others here. So I don't understand why that person will come. I can tell you that we brought that up with the general when we a couple of weeks ago, because I actually brought it up. I said, look, I'm living in Quebec. You know, we're a Quebec border here, and what are we supposed to do? And he said, we have to reciprocate. And so I really can't stop it. I mean, it's a one-off, and we got to look at it that way. And I'm hoping that they can reciprocate on the other side. And we were also asking that about interregional, and they said, no, it's an Ontario program. The vaccines are purchased by Canada, so it's a Canadian program by extension. So at this point, I wouldn't. I don't know why, because my impression is that there's empty slots in Quebec as compared to here, and they vaccinated earlier than we did. So,
All right, thank you.
no problem.
Dr. Paul, the questions from James Morgan, the review are, after clinics where there were delays due to problems with the booking system, can we be sure that the problem does not exist when the same people go for their second dose?
I'm hoping, James. We've been speaking with the ministry. We ensure that they don't double book, and they assure us that it was a lot of the stuff that happened in Hawkesbury last week was because they had done the bookings before a certain date when they had changed and removed the bugs in the system. So I'm hoping that it'll be a smoother ride. And I can tell you that since that, all other clinics have gone very smoothly. So, and this is the second part. Like we started this past week with the second batch, because that was the first batch that was delayed. So I'm hoping that it'll be smooth sailing. So far, so good.
Thank you. Second question from James Morgan. Are people who do not live in the same house permitted to walk together in the street during the stay-at-home order?
Technically, they should not be gathering. There should be there's no group. There should be if they're walking outside with the neighbors, for example, there should be socially distancing, and there shouldn't be more than 5 people. That's the law. And at this point, we don't want to look for loopholes. Want to stay home. Bottom line.
Thank you. Question from Nation Valley News. How long do you feel the EOHU will be in pandemic footing? A year longer?
Well, I don't think, I think that we're all going to be in pandemic for the next year, between now and Christmas. I think it'll get better. I think we'll start to recover towards the end of the year, but we'll be recovery mode rather than sort of acute mode. Hard for me to predict, but if we look at the numbers, if we look at vaccinating a whole population, progressively removing restrictions, and what I'm predicting is likely having to vaccinate kids in the fall. I think that we're looking at this year as being still in pandemic, less intense, hopefully less cases, more and less restrictions moving forward. If we need a booster or whatever, that can be incorporated into normal business moving forward. It doesn't necessarily mean we'll be in a pandemic mode. But again, I do believe that we will have some kind of a form of pandemic preoccupation, for lack of a better word, between now and the end of this year for sure.
Thank you. Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you. Merci.